A few tidbits on why your nose may feel blocked and your CT scan. First, how a CT scan works. It analyzes your anatomy in slices, similar to a sliced loaf of bread. Dr. Patel will go through an example next.
And we're going to be moving from front to back. Now keep in mind that everything is flipped. So this is the left side, this is the right side. These are actually the nostrils.
And we are looking from the base of the nose or the worm's eye view.
Left nostril, right nostril. This is the island of skin that separates the entrance of the nostrils, and it's called the columella. And so here we'll start moving back. And in this particular person, this is what we call the septum, and you can see it's actually deviated over to the left side in this person, and in fact blocking this area where it's touching the outside wall. And this is why breathe right strips work. This is why when you pull your cheek, if it helps you breathe better, it works because the cheek is attached to the skin of the nose, which helps lift this wall up and out. In this person, that's causing a blockage. As we go farther back, you can see that it continues to be blocked. Air is black, soft tissue like skin, muscle, and fat is gray, and then bone, which you're starting to see the bone on the bridge of the nose right here, is white. This is the forehead and the bone of the forehead that's coming into play. This is the sinus behind the forehead. Left eye socket, right eye socket. Here's that septum again. These are the turbinates that help humidify air. You can see the left one's a lot bigger than the right one in this person, and it takes up a lot of room in this person. This is kind of what we call a spur, which is a sharp kind of outpouching of the septum that can block the airway as well. Now this is the sinus behind the left cheek, sinus behind the right cheek, left eyeball, right eyeball, sinus between the eyes. As you kind of go back, this septum continues, and these sinuses also continue to go back. These are actually teeth right here. And so in this person, you can see that their septum is deviated in the back over to the right. Up front, it was to the left. That's taking up room, and then these turbinates are taking up room. And so this person has the three most common causes of blockage, which is the turbinates being big, the septum is deviated, and then right here where the valve is kind of pushed over. I always tell people our goal is to get things better, not perfect, and part of the reason why is if we go farther back, you can see that the roof of the nose is actually the floor of the brain. And so if we try to take something where we get better, for example, if we straighten the septum up and we try to go for gusto, but it involves manipulating this area, it can get dangerous.
And that's why I often say it's better to shoot for improvement and not perfection, because there can be increased risk.
Hopefully this information will make your chat with Dr. Patel easier. Let us know if you have any questions.